Molluscum contagiosum is a skin condition that causes little bumps all over the body. They're kind of flesh colored, or maybe a little bit pink, and they often have a little depression in the center. Molluscum is caused by a virus called the Molluscum Poxvirus, and think of it kind of similar to warts. So molluscum can be transmitted from person to person. It can be transmitted by objects. It could be, sitting next to someone on the school bus or sharing bath toys or sponges. And, remember, it is Molluscum contagiosum, so it is something that can spread from person to person. The good news about molluscum is it's benign. It is self-limited. Your body will fight it off eventually. The challenge with molluscum is that may take a very long time. So it's probably an average of about 1.5 years, and sometimes it can be a lot longer than that. Some parents elect not to treat at all and to let the body take care of it, and that's okay. That's something that we as pediatricians and dermatologists have supported for years as a choice. But some parents and patients want to have treatment options, and so we are fortunate to be able to have an FDA-approved medication now that's called YCanth, and it's a form of cantharidin. This is a medication that is applied in the office by the physician, and it causes a very small little blister just on the area where the bump is. The good news is this stimulates the body to take care of it, okay? So it's kind of shining a spotlight on the little bumps and telling the immune system to come there and attack it, and it hastens the resolution. It's going to speed it up a lot more than if you leave it on its own. The treatment we do in office is not painful, okay? It's basically like me painting with a little stick, and you can expect over the first couple of days to get a little bit of blister, a little redness in the spots, sometimes some itching, maybe a little very mild pain. Usually I recommend to do some itch products and some ice, and then if you need to, any Tylenol. But most of the time, parents and patients say you don't need any treatment. The treatment is going to be applied in the office, and it's going to be applied every 3 weeks. And the good news is that we are able to see you in the office and start treatment same day. So we're able to take care of that for you. It's covered under insurance, and we're able to get the lesions to improve even after the first treatment. It does take a few treatment sessions usually to get rid of it, and so that's something that we're happy to keep treating you here in the office until all the lesions are gone. And I just want to show you what it looks like, okay? So this is how it comes. It's a single use for each time. This is called YCanth, all right? So you see, it's just a little purple liquid. It's a little purple liquid in a pen. So I just say, I'm gonna paint on you. I'm gonna draw just on your little bumps. And it's not scary. It doesn't hurt in the office. So this is different from cryotherapy, from freezing, from certain prescription medications, or over-the-counter medications, which, can work sometimes, but not always. So it's really nice to have an option that I can apply in office, no homework for the parents, and it's very safe and effective, and it doesn't hurt in the office. All right, so what you'll see me do in the office is I have this, and we have our little break tool. I'm not gonna do it on this one, but we put it in here, we kind of break it, crack it open, and then we're able to just paint on just the individual lesions, just the little bumps, and it causes a little blister just right at that bump. The nice thing is this really makes sure that we don't get the surrounding skin, so it's not going to be anywhere near as irritated compared to some other products that people have applied for many years for molluscum. So we're really happy that we're able to offer this as a treatment for our patients in office, and we hope that anyone who is seeking any treatment for molluscum feels comfortable coming to our office to discuss options.